Some medical decisions that you make can have huge impacts on your life and loved ones. That's why it's important to fully understand the situation so you can feel comfortable with your decisions. In this video, we'll learn about informed consent. Hey everyone, my name is Dr. Graham Dersnah. Welcome to Bite Size Medicine, your go-to channel for short, easy to understand videos about the common medical topics that matter to you. If you're new, make sure to subscribe, get involved in the comments, and check out the description below for links and resources. Let's get started. If you had a problem and your doctor were to simply say, "Surgery will help, sign here and I'll add you to the list," how would that make you feel? Would that be enough for you to say, "Okay, let's do it"? Or would you want more information? Let's talk about what should be addressed in the conversation before you sign a consent form. Consent is an extremely important issue, both within and outside of medicine. In general, consent involves providing permission for someone to do something to you or with you, or you're agreeing to or accepting something. And if at any point you say no or stop, you've taken away your consent, and that action should be stopped immediately. In medicine, that definition still applies, but to give informed consent, you need to be given enough information about your options so you can be confident in your final decision. To be informed, you should be told what the medical problem is, what the proposed plan is to treat the problem, such as surgery, the risks and benefits of the proposed plan, any alternative options you can choose and their risks and benefits, and the risks of refusing treatment entirely. With this information, you'll be able to choose the option that is best for you. Your medical team might advise you about the option they feel is best based on their experience, but in the end, you have to give your consent for the option you want. You should also be given the opportunity to ask questions, and some other information you might want to know to help with your decision includes: who else will be in the room during the procedures, what might life be like after the treatment, and what is the cost of each treatment option. The language used by the medical staff to explain your options should be in your preferred language, so request an interpreter if needed, and the words should be easy to understand without a lot of technical terms. Finally, after you have given your consent, which is done by signing the consent form, if something changes or you become uncomfortable with the plan, you can withdraw your consent. If you do, the plan should stop and you should have a conversation with your team to decide on a new plan. As you can see, there is a lot more that goes into making medical decisions than just hearing an option and agreeing to it. Collaborate with your doctors and other medical staff and your support system as a team to decide on the best course of treatment for you. Before you go, make sure to like, subscribe, and leave a comment. Let me know if you enjoyed the video, learned something new, have any questions, have a personal experience in this area that you'd like to share, or have ideas for a future video. Thanks for joining me, and I'll see you next time for another delicious bite of medicine.